All right. Welcome back, everyone, to the Mental Health Evolution podcast, where we are talking about how the landscape is quickly evolving in the mental health industry. Today, we are taking a look at none other than AI. It is a hot topic really everywhere, but especially in the mental health world. And our guest today, Dr. Jordan Harris, has researched and written about what is happening with AI. He is also a therapist and he coaches therapy practices in their growth and just figuring out what to do with artificial intelligence in general. As always, I want to give a little background here to set the stage for our conversation so you have some information about the topics we are addressing. Here are a couple things that have been in the news. First, from telehealth.org, we have the article about Amazon Health Services and Talkspace partner for virtual therapy. So, this is a corporate partnership between these two companies, and the article outlines the elements of that partnership as well as the implication that these two companies plan to use recorded sessions and written interactions with clients and therapists in order to train AI to take over the therapist role. They're not making this a secret. That's kind of something that's happening in a lot of forums, and this is just one of those. Then I also want to reference an article from Fortune magazine. This was pretty well distributed article and the title says in a showdown of psychotherapists versus ChatGPT, the latter wins, new study finds. This study was interesting. It set out to tell if people could tell the difference between ChatGPT, that therapist, and their therapist and which they preferred. So they found that participants had difficulty identifying whether responses were written by ChatGPT or by therapists. And they correctly guessed that the therapist was the author about 56% of the time. And they correctly guessed that ChatGPT was the author about 51% of the time. So, kind of a 50-50 split there, whether they could tell if it was ChatGPT or the therapist. And then further, the article goes on to say that in most cases that the clients preferred ChatGPT's take on the matter at hand based on how they understood the speaker, showed empathy, what they said was appropriate, and what a good therapist would say. Of note, this was specifically couples therapy, and this was written responses between either a therapist or Chat GPT. So, not sort of the full AI presentation here. And lastly, I want to reference the article that kind of was the springboard for this episode of the podcast. And that's Dr. Jordan's article. And he wrote an article called AI is Reshaping Psychotherapy. We have 2 years to get ready. He outlines in this article that there will be four big players in the AI therapy space: insurance companies, model based apps, big box provider platforms, and general large language models. He also talks through the idea of autonomous AI being a co pilot in therapy and potentially helping us with process coding, meaning that we would receive real time feedback to enhance attunement and effectiveness in the therapy room. His article is robust, and there were a lot more pieces. That's just me pulling out a couple of highlights there so that our listeners kind of have some background with what it is that we're referencing and what we're going to be talking about. So, with that, I would like to open up the conversation with our guest today and talk through some of these events, as well as looking at how to make meaning of all of this from the perspective of clients, clinicians, and businesses in this space. So, first, I want to say welcome, Jordan. Thanks for being
Hi,
here.
thanks for having me. Glad to be here.
Yeah. So let's look at the overall patterns happening with AI in the mental health space right now. What are you seeing so far?
Yeah, I mean, there's sort of two things that I'm seeing. One is that no one knows what's happening. I mean, this thing is
Yeah.
moving so fast. Um, every week there's a new thing happening. Particularly in the mental health space, people are really trying to figure out like what are the limits of what we should allow it to do, right? So it can do a lot, but like, should we allow it to record sessions? Should we not? Like, we don't, those are all questions that we're trying to figure out. And so with that, a lot of what I'm also seeing is the first thing that a lot of people are testing out is just like straight note taking, right? Can this thing do my notes? Um, Beyond that, I mean, I think there's a few different ways that the field is sort of unfolding, but we're trying to figure out as a field, and I think as a society, like, what is this thing and what's it going to do?
Yeah. Yeah. Do you have a particular stance on this whole idea of AI taking notes for us in session?
Yeah, so, a lot of people think that it's unethical, that it violates privacy and confidentiality sort of things. Um, I- there's two things to that in my mind. One is that I don't think that it does, right? Like you have a duty to do informed consent, but it as long as you're doing that, there's no reason why you couldn't have it record your sessions, unless there's some sort of law specific to your state, right?
Hmm.
If you think about like for me, I went to college and all of our sessions were recorded and we reviewed them with our supervisors. Now this is back in the olden days where we met
Old
in
school.
person. We met in
Recording
person and like
session.
you know what I
Yeah.
mean? Like
Yeah.
a decade
We didn't
ago, back,
store it to the cloud. We just
we
destroyed it
didn't.
right on yeah.
Right, right. So like, but we had it in our informed consent. People knew that when it came to the university clinic where I was learning that they were going to be recorded and watched, and that's what happened. The other thing is, and this is I think the thing that's important because the field is moving so fast. I don't think regulatory bodies, which are usually
Mm-hmm.
like AAMFT or the APA or the state boards, can move fast enough to tell people what to do. We
Yeah.
might see some like standards of care type stuff, but like, my state board is struggling to get us updated onto a digital platform for license renewal. So I don't think that they're going to be telling me about how to use AI anytime soon. Like it's just not going to
No,
happen.
no, I think you're right about that. Yeah, but I am one of those people that I do think that there are ethical risks to doing this because once that recording exists, we don't have control at that point. I hear your client consent piece, but I also sort of wonder if clients know fully what they're consenting to. Um, from the perspective of I've talked to several different AI companies about like what happens, right? And they all will say, well, some of them destroy the recording,
Sure. Yeah.
but all of them data mine the recording. So there's this whole nuance between, okay, maybe the actual recording is destroyed, but what about the data mine? Then my additional concern is what if policies change and they decide it doesn't benefit them as a company to destroy these anymore? What happens if attorneys in a case get wind that there's information they can access? There are all these protections maybe there to just think about. I think for me, rolling out anything like this, we need ethics. In our field, privacy and confidentiality is the whole reason why people are safe enough to come and talk to us, right? So that's just, for me, that's just one piece that I wonder about with AI note taking.
I mean, when I'm thinking about ethics, I'm thinking about like what are the actual ethical codes I have to adhere to, and what are my state legislators saying. And so, to my mind, if I'm answering this question, it's there's nothing in the ethical code that I have to adhere to or
Mm,
the state legislator. Now, like morally, what's maybe best for the practice for my clients? I think your questions are totally valid.
mm.
The only thing I would say is most of our clients are already giving away their data and they don't care.
I hear you. Yeah.
So if I have a client who says, this wigs me out, I don't want to do it, then I'm not going to do it, right? But,
Mm,
like even in the article that I wrote, um, they surveyed about 500 clients, and like 98% of them are already using ChatGPT or some other sort of large language
mm,
model. People,
mhm.
I mean, if you're on social media, like if you're on X or LinkedIn, like they're already mining your data. So I think we care a lot about that for other people, but for ourselves, most of us just give our data away anyway.
I mean, that's a fair point. I think that is happening everywhere all the time. Yeah. Yeah. But maybe not with the content that people are sharing in therapy, right?
I mean, that's a good point. The other thing, and this is my bias, my background is really in um, clinical expertise, right? How do we become a better therapist? And one of the things I think we see across fields, there's two big ways to become better at any field. And one of those ways is through the data. Like if you get better analytics, whether
Mhm.
you're a pilot in an airplane or a baseball player or even comedians, I've seen comedians like track the amount of laughs they get. Like they just get better
Mm,
at their field. So personally, I want to help people. And again, if my client says that this is not for me, I'm not going to force this on them at all. But I will take what tools I can get to help people better.
yeah. Yeah,
So
I hear that. That's understandable. So I would love to talk about this whole idea. It mentioned it in one of the articles about that AI or ChatGPT might be a better therapist to a human therapist, and I would love to hear some of your thoughts about that.
yeah, so I mean, this goes back to two things to my mind. Um, so last year, like I said, my whole push in my actual academic career is expertise, with clinical expertise. And so a buddy of mine who has written a ton of books on clinical expertise recommended me to an article by two researchers, Henny Westra and Alyssa DiBartolomeo, about clinical expertise. And basically what they found is they specialize in studying resistance.
Hmm.
And what they mean by resistance is any moment where the client says, this is not a good fit for me, therapist. And what they basically found is that most therapists, not only do they misrespond, they don't notice those moments are actually happening. They just don't see them.
Hmm.
Um, and so I mean, this is kind of extreme, but I paid Alyssa to coach me for about a year so that I could see this dynamic. And it's everywhere. It happens a lot. So when we're talking about AI and therapy, one of the big things that I see online is people saying things like, man, this AI, it's sort of too nice to other people.
Hmm.
And on the one hand, if someone's like in a real sort of delusion, right? If they're really in a place where they're really at a risk for themselves and for other people, like that's not good. And I have friends who are working on this problem now of how do we actually make these systems safe? And a lot of systems, not all large language models are safe, but some of them are actually pretty safe already. But the other side of this is that this thing that AI does, where it is consistently validating,
Hmm.
is actually the antidote to a lot of resistance. Now, you have to be careful that you don't validate poor behavior, but validating positive intent, validating underlying emotions, and being relentless in it. I mean, from the research that I've done and the coaching that I've gotten, um, we don't do enough of that. And I think that's one of the key reasons why this these large language models are so persuasive
Hmm.
because they are consistently validating. I mean, even back to the old, to me, this all is like sort of a weird conversation to have because like 60 years ago, you had Eliza, which was the first chatbot. right?
Hmm.
And all it did was Rogerian reflection, and people loved it. Like they lost their minds about how amazing it was, right?
Yeah.
Like, so now we have that, but like a million X, like, yes, it's really good because when you're working with people in these really tender spots, they need a lot of support.
Hmm.
And so, and especially when most therapists don't really see that they're not giving their clients as much support as the client would really like, it's no surprise to me that these models are doing really, really well.
Hmm. Yeah. Yeah, but there, I mean, I guess there's also the other piece of that. I've heard it called psychophantic bias, right? That Chat GPT is a yes man, that AI is a yes man. That's kind of what you're saying, right? And that if you say, I don't like that response, give me a different one, they'll give you a 180 response. Um, I think that's fascinating. So we're almost I guess for me, it takes away that human element in the
Mm.
room of psychotherapy where we are talking and putting out who we are, and there is another human being taking that in and feeding that back in some way, right? Basic attachment kind of human interaction. And maybe we lose that if we only get exactly what we're wanting in response.
I mean, you're hitting on, I think, a few different points there that I think are really important. The first is, will the models of tomorrow be as agreeable, right? So like
Mm.
on the level of reflecting, validating your intentions and your emotions, I think that most clients actually need a lot more of that than we're actually giving them. In terms of like the behaviors, no, not every behavior that you have is valid. And my sense is that the models that are trained to be therapy models won't have that problem,
Mm.
right? Like that'll be part of the difference. And so that's my first sense. The second thing is, and I think this is a really important question, and I think that we're going to find out, is I 100% agree with you. Like there's something that we lose in the person-to-person interaction, but I'm not sure that most people will actually care.
Mm.
My model for this is the old Harry Harlow studies, right?
Oh, yeah. The monkey studies?
The monkey studies basically showed us that mammals are cue-based, right? And so if this wire monkey doesn't have the cues that we need for softness, right? We don't perceive it as being warm. But if it's terry cloth mother does, we perceive it as being warm and we'll attach that thing. And so and I think that this really goes back to your question of what did we lose? And that's like the question. But will most people be like, man, this terry cloth mother feels really good? I think a lot of people will. I think a lot of people will. And I
Wow.
saw something today that like 20% of people who use AI are using it already for like romantic partners. So, I
I have
mean,
seen that. I know. I know.
oh yeah,
I mean, that's a whole other topic we,
it's
we
a whole
could
other
go
topic.
that
It's a
rabbit
whole other
hole.
topic. But yeah, I mean, I
Yeah.
think
Let me dive into another thing that you say, even in your title. So I feel like it's an important piece, but you kind of frame the next 2 years as a critical window for adaptation. So I'm curious from your thoughts, what needs to happen during the next 2 years and kind of what happens if we miss it?
yeah. So that 2-year window comes from a few different things. One, it's from a interview um, between Ezra Klein and the chief sort of AI officer under Joe Biden.
Mm.
And in that interview, they basically said that Biden was well aware that within the next 2 years, we'd have autonomous AI, right? And then
Okay.
everything flipped because Trump was sort of like the president and they didn't see that coming. So they're like, it's coming in the next few years. The other thing is that there's a report out called AI 2027. I don't know if you've read this report. It's really fascinating. And basically,
Okay.
they're also saying 2 years from now, we're going to have AGI, right? Super AI, which I don't know if that's going to happen in 2 years. I don't know if anybody knows, but I do think the next 2 years are going to be like a crazy period. And part of why that happens is we're in a Cold War for who gets AI first. So we're getting a lot of funding in it. I mean, as soon as Trump was elected, he called all the tech leaders were in like literally behind him, right? Like up on the at the inauguration, and he gave Sam Altman like $500 billion. Oh, something, some I don't remember the number, but some like astronomical amount of money that he
Mm,
partnered with. So we're in a Cold War with the government basically saying, give as much money as we can toward this. And the first thing that all the AI companies are trying to do is use AI to code. They're trying to use it in a recursive process to make it better at making more AI. So that's where all the energy is going. So that's why I think the next few years are like we're going to go through a time warp, in my opinion.
mm,
I think what this means for us is, and this goes back to the business side, right? So as much as I'm academically interested in this question of expertise, um, I have a practice where I do all these things. I also have a business where I help people launch their practice and run practices. And the biggest issue in most practices is retention. I saw a study last week. I posted this on my website that went through and categorized different types of therapists based on outcomes. And
mm,
in this study, 25% of therapists were inefficient and ineffective, right? As in
yeah.
on surveys of, hey, how much do you like your counselor? Clients said, I don't like them very much. And then on outcome surveys of how much better do you feel? They said, I don't really feel better. Another 40-ish% were good for some people, right? But for the rest of their clients, for whatever reason, the clients dropped out really early in therapy. So what this means is we have somewhere between probably 25 to 60% of counselors who struggle significantly, at least with some portion of their caseload.
Mm.
So here's what I think we have to do. I think we kind of got to button up, right? Like I am very pro people. I don't think like I am very much of the belief that other people might choose to use AI as a therapist. I don't think it's a field that we should be. I don't think that that's best. I believe in the human connection, but I don't want to deny what I think other people will do. And so we want to really be people who are standing in the gap for our patients, for our clients. We have to really, I think, up level in our skills. Like
Mm,
if a quarter of therapists are not doing great in their practice, like we got to help those people to really meet clients where they are so that the clients can actually get what
yeah.
they need from a person.
Mm-hmm.
So that's the
Mm-hmm.
first big thing is I think we got to upskill. And then the second thing is we have to be using these tools now so that we're familiar with them. And I mean, they change weekly. So pay the $25, get the pro subscription and like start playing with it, start using it. Um, maybe not for your notes, maybe for your marketing materials, right? Maybe for your logos, maybe for your newsletters, like maybe for your blogs, like use it to develop those. And then I think the third thing that we need to be doing is not fighting it, but really pushing for any way we can to use it, right? I think if we fight against it, the the, the house is against us,
Mm,
right? But if we
yeah.
really join this thing and say, hey, like let's use this as a co-pilot, let's use this as a librarian, let's use this as a assistant to us, we can use it and we can use it as a superpower to really help people. So those are my like three big things that we have to do.
Mm, I like that. I think for that last one, to me, there's also this maybe this duty for us to ethically use it ethically, right?
Totally,
Figure out
totally,
how we can make sure it does no harm to
totally,
clients. That's already happened, and use it in a way that can be of the greatest benefit, yeah, to people.
totally.
that.
I will say, and so I also work at I adjunct and do some consultation with a university called Cintio, and they're on the forefront of this stuff,
Mm,
right? Um, and so we're getting training on this in our faculty meetings on how to use it ethically. So maybe I'm less afraid of that because I'm getting training in it. And they
mm.
have a class that they're putting out in September, I think it is. And I'm not getting any sort of kickback from this, but I think it's helpful. They're giving a certification on working with using AI in your practice. So I'm
Wow.
very much a fan of what you're talking about, and maybe I'm a little bit less worried because I'm getting training in it. Maybe other people aren't.
Yeah. Yeah. I think that's a unique thing. I have not heard of another class like that. Not that they're not out there, it just hasn't crossed my path. So that's very cool. I
Mhm.
like that. Yeah. All right. Well, with that, we are about out of time. Um, Jordan, thank you so much for being here and digging into this discussion. I feel like there were even more things that we could have gotten into, and I encourage everyone listening to read his article and to dig in more and more to what's happening so that we can be aware, so that we can be smart. Um, Thanks everybody for listening, and I hope you will join us next time for another look, another view at the changes in the mental health industry.